Hey ladies! All right, so what if you have Asherman's syndrome and uterine scarring? Asherman syndrome is basically the technical term for uterine scarring. What can you do to get pregnant? This is a very common question that I get. So just a little bit about Asherman syndrome. It's mostly caused from having procedures like D&Cs, whether from abortions or if you have miscarriage, or if you had procedures to diagnose and remove any abnormal growths. This procedure, the D&C, can cause scarring in the uterus and adhesions. And then the adhesions, the symptoms of Asherman syndrome and this uterine scarring may be that you're not getting a period, or your periods are very light, you're not able to get pregnant, you may have pain with your period, or even if you're not getting a period, you may have pain because there's a cramping, your body is trying to shed the uterine lining tissue, but there's scar tissue that's blocking the cervix. Your uterine lining isn't able to shed and regenerate itself. And then you can imagine there's poor circulation to the uterus. Wherever there's scar tissue, you're going to have reduced circulation. The tissue is going to be like a little thicker, harder. It's not going to have that kind of like life to it. Then you can get additional residual tissue that's left in the uterus because it's trying to cleanse itself out, but because of the scarring and the adhesions, it's not able to properly flush itself out, and then that residual tissue can also turn into like polyps and so forth. And obviously, this is going to affect your ability to get pregnant. It's going to affect your ability to have successful implantation. So it's a real issue, and it's really difficult to treat. There's not a lot that can be done from a Western perspective. There are doctors that will do additional procedures, but obviously to kind of try to clean out that scarring and those adhesions. But obviously that comes with a risk, because what caused the scarring and the adhesions in the first place were procedures. So it's like a catch-22. That's the only thing that they really have to offer to address the situation, but it could worsen the situation at the same time. In the case of Asherman syndrome, it's that much more important that you take matters into your own hands, and that you employ methods to, from the inside out, clean out that uterus and create a healthier environment and soften and break up that scar tissue. It is possible. I've had patients who've done it and gotten pregnant successfully. Now, from a Chinese medicine perspective, from my perspective, when you're having really light periods, or maybe you're having periods that are light, but then you're also having some like dark tissue or clumps of tissue and so forth, then this means that, for one thing, there's not enough blood flow to the uterus that's really nourishing the uterine lining. There's stuck blood, stuck energy, and a lack of nourishing energy and blood to the uterus. And so it's really important to address this, to increase the circulation to the uterine lining, and to also improve digestion, and to really nourish the body so that it's able to build more healthy blood cells to deliver to your uterine lining. So we're not only working on circulation to the uterus, but we're also working on digestion, because nutrition and your ability to actually break down food and turn it into nutrients that your body can use is really important, so that you have those healthy blood cells to nourish your uterine lining. And you need to work on stress, because stress constricts blood flow. And the body is often fatigued, so we need to restore energy in the body so it has the energy to move this, break down and move this stagnant tissue, the scar tissue, the adhesions, and all of the other buildup there from the blockage of flow. So you can't just rely on a Western approach, which would be surgery. And if anything, you want to avoid surgery. So you have to address the situation inside out. And the methods of my program, Fertility Activation Method, are designed for this purpose, not just for the case of Asherman syndrome, but for a variety of fertility issues. The goals are often the same, which is creating a healthy uterine environment, replenishing the body's resources, and so forth. But in the case of Asherman syndrome, you really need to employ these holistic methods to create a uterine environment in which you can actually get pregnant and sustain that pregnancy and have a healthy baby. And the good news is that, you know, these tools work. And you can, and for instance, castor oil packs, which you can go on my website to the blog, and I have a video that explains how to do castor oil packs and so forth. So a castor oil pack is a really good way to begin that process of softening up that scar tissue and cleaning out the uterine environment. But you really need to be very consistent. Supplements are also really important. I have a free supplement guide as well on my website. So because your body really needs the nutrients, because it's not just a case of having that scarring, but what makes someone prone to that uterine scarring, because you know, there's many women out there that have had abortions or miscarriages or procedures, and they don't all end up with Asherman syndrome. So what makes you more prone is that your body was most likely lacking the nourishment and the circulation and the energy it needed to properly heal the uterus after having had those procedures. So again, you need to increase the circulation to the uterus, get a healthy period, unblock those blockages, and nourish your body so that it can nourish the uterus. And then you can get pregnant. Simple as that, right? So that is what I have to offer on Asherman syndrome. And if you want to learn more, then I would strongly urge you to watch my free masterclass. You can sign up for it in the link above this video. It's my #1 fertility secret for getting pregnant without IVF or drugs. But I will explain to you how my 4-step method works for creating a healthier environment and getting your body into a fertile state and improving your uterine environment so that you're able to get pregnant. But again, I cannot emphasize enough how important it is for you, if you have Asherman syndrome, to take these matters into your hand and use these resources which work. These are tools that I've been using for over a decade now from clients that I've worked with for creating a healthy uterine environment. So please, please, please do this for yourself. I don't want you to have to go through more surgeries and for the situation to get worse. So again, you can sign up for free for the masterclass in the link above, and I hope to see you there.